We hear that a lot from our medical malpractice clients. They've been involved in a medical procedure and there's been an injury that they sustained, a malpractice in the process, and they're not exactly sure who is responsible for that. And we work very carefully with the doctors, and we have expert doctors we work with. We obtain all the medical records and review all the medical records and notes to find out what the cause was of that client's injury in the malpractice. Sometimes it's more obvious than other times, but there are times when it's not obvious what went wrong, and we really have to explore the evidence to determine that and find that out. Look, most doctors are good people and they're human, and the reality is they do make mistakes on occasion, and mistakes are made by hospital staff, and in those scenarios they need to take care of the patient who was harmed and injured in the process. I'm reminded of a case where our client actually was the spouse of the injured person who lost his life, but he was in for a medical procedure. It was internal surgery where he was opened up for the surgery process, and the doctor did the main part of the procedure and then left and allowed the medical intern to what's called close up and sew up and finish up the procedure. And the doctor had left, we found out later, to play golf. And the intern, not having the experience of the doctor, that's why they're an intern, to get experience, and the doctor's supposed to be supervising and watching, but the intern nicked an artery in the process, and the patient started bleeding. And the numerous attempts were made to get a hold of that doctor. The doctor ignored the texts and pages and calls, apparently because he was too involved in his golf game. And the residency intern struggled with the process without the experience and knowledge, and the patient unfortunately bled out in that process. That's an extreme example, horrific example, but there are many cases where mistakes are made along those lines, where people are either not taking responsibility, not taking their job seriously, and it's egregious, or they simply make a mistake, and they should still step up to the plate and take care of those things. Another example I can think of is where the doctor worked on and ended up amputating the wrong ankle on a surgical procedure. And there was confusion as to the process of identifying the ankle. Did the patient identify the wrong ankle, and so on and so forth? But the reality was the patient and the records reflected the correct ankle that needed the surgical procedure performed on it. And the doctor, who has many patients, if you've been to an outpatient surgery and type of surgery, you know they're running them through fairly quickly, back to back, and the doctor got confused and operated on the wrong leg, the wrong ankle, and that was a procedure. But there's also medical malpractice where doctors are not paying attention to the medications that a patient is taking currently, whether that doctor's prescribed them or another doctor has prescribed them and they're taking those, and then they prescribe a medication that conflicts and that causes harm to the person, and that's just not paying attention to the medical records. We go to our medical professionals because we're not doctors. We go to them as patients, and we put our trust in them that they're going to take care of us in what we see is something we have no knowledge about, and we want them to fix it. And when that trust is violated for whatever reason, you have a claim and you should pursue that claim, and there is insurance in place that we are pursuing on behalf of that.